So I introduce you, and please, I think we can start
Yes.
the
Okay,
we
thank
can
you,
start the
Thomas.
course.
I thank Dental Pharma for the collaboration and organization in these informative courses. This is type of the courses, the name educational. This is the short courses only for divulgation. Okay. This is courses will last about 1 hour and with consistent slide and the videos. After the first hour, about 20 minutes for you see the practical. I use the secondary webcam and use the laser for two type of the tissue. Okay, let's introduce myself. My name is David Boscolo Anzoletti. I have been involved the scientific disseminator and training since 1999. My collaboration with university in Italian and abroad. Okay, I am an honorary member to the SNOI, the Society of Odontology or Dentistry in Italy, and the CD, Society to Hygienists, because in Italy the hygienists have professional book and political power, have many society in Italy. Okay. I manage to Creation Academy. The Academy is a network in the platform for the provider training on the use the creation products. In this case, the courses are to the laser, but we produce many types of instruments to the dentistry and have different types of the courses. Creation Academy, it's a network with about 5,000 of the professionals. The training courses, it's divided in the 4 types, okay? Educational, this is same this, okay, 1 hour about for divulgation. And the scholarization courses, this is the courses when the dentist have the laser in this case, and during about 3 hours and have a practical part where I do the tutor to the use the laser in depth first online courses because the protocols it's 18 and it's divided in the 8 family of the protocols. Every 2 months I do the courses for one family 1 hour online for refresh the use of this type protocol. In depth the second with types of the courses in the person, it's possible organized at 1 or 2 days for in depth for only one arguments. Okay, the different to the educational courses and scholarization courses is during the educational during about 1 hour, scholarization 3 or 4 hours, and have the practical part. For example, the slide number to the educational is 133, the scholarization 507 slide. Okay, this is example when I do after the courses the tutorial. I don't touch the patent because I only researcher, okay, but this is the condition and the certificate the courses and in the box to the laser inside the book that included have the protocols, have 18 of protocols. This book have in 3 language, okay, in Italy, in English, and in Romanian. Okay, this is completing the courses. The course spec included the telephone help desk service. We don't perform remote diagnostic, but we do provide the guidance on the correct use and the keep it. If you have problem, don't worry, resolve online the problem. The sponsor of these courses, its creation is a brand MB Electronics, a big company that produces electronics and medical device, design and produce in Italy, Como, little country next to the Milan. We produce 4 types of the laser, The first laser is a blue laser, and this is only for cut, for surgical. The blue laser have the wavelength 445 nanometers. Another three types of the laser that have two wavelengths, 810 nanometers, primary line, and secondary line, 635 nanometers. The difference is the three types of the laser and the power and the certificate. The first laser have 5 watt and the certificate for dentistry use. The second, the gold laser, the 8 watt and have certificate to dentistry, aesthetics medicine, dermatology, arteriovenous, and physiotherapy. If you want a big laser, we have the third laser, 5 and 1.5 watt, for use the same the 8 watt, but with high power. Another product, the creation, it's a mallet for surgical use, for extraction tooth, in this case use this, okay, the intraoral welder for immediate loading, or electroporation for medicine aesthetics. We produce another types, two instruments, micromotor, piezo, but in this case, this is a production, it's joint ventures with the company Korean. The company Korean produce the mechanical part. We make the electronical part. Okay. Inside the box to the laser, we do the marketing pack along with the device provided the pack. Flyer to give to the patient and the banner to place in the waiting room, and the system for geolocalization your office dentistry. Okay, let's familiarize yourself with the laser. What is the photon? The photon is a partisan to the light that don't have constitution, but you have the band touch another types of the particle and transform in the contact transform in the hot. The light amplification, simulation, and irradiation. This is the laser, the acronyms. The wavelength that interest are only two, no another types. For the soft tissue in dentistry, the 810 nanometers, 635 nanometers. Another types of wavelength is not good for dentistry, and I show what's the problem. The human see between the 400 and 700 nanometer. After have the infrared is good for the types of radiation is good for the body human. Before the violet on the blue have red UV, and array of X is not good for the human because have potentially teratogen and mutagen condition. Okay, we like the red light and the infrared. Some tissue absorb the light only at a specific wavelength. The photon were interested in the are particularly attracted to the brown and the blue one. Thus, chromophores contract the light energy in target areas and promoting to its absorbing. We have the endogenous chromophore, hemoglobin and melanin. In alternative, we have the exogenous chromophore. For example, blue methylene, toluene blue, and povidone iodine. You remember that the subject, when you have a subject with glucose 6-phosphate deficit, absolutely cannot take the blue dimethylene. In this case, use iodine povidone or toluene blue. The 5 biological effects of the laser are interaction to the tissue. Oh, okay. It's inflammatory, physiological analgesia, agnosticis, decontamination, and biostimulation. This is the 5 good effects to interaction to the laser and biological tissue. Anti-inflammatory action thanks to action to the prostaglandin cytokine interleukin. Physiological analgesie, thank you to affect to interaction the laser to the Schwann cells and Ranvier node. In this case, polarizing the stimulation reduce resulting for the nociceptor action. Hemostasis, we have hemostasis thank you to interaction to the laser and iron inside in the blood. The contamination, we have this effect thank you to particular effect, physical effect and physical chemical effect. The first action, the thermal action of the laser radiation allows the elimination of the pathogenic bacterial flora and the disgregation the pathogenic micromolecules above 50 degrees. The second effect, chemical and physical, if you use irrigants such as methylene blue or protoporphyrin and the laser, we have released the single oxygen and the naturation by oxidation of the bacteria. Biostimulation. Biostimulation, for me, it's the most important, is the first motivation to use the laser inside the dental study, okay? Dental office. This effect that act to the cellular parts, the tissues, affected the mitochondria thanks to the primary light, the 810 nanometers, and protein act to the fibroblast through the secondary light, the 635 nanometers. This is so much important. You have inside your laser two diode, no one diode and one light red only for illumination, because in this case don't have these types of the effect. Okay, we see the 5K element for choosing laser for dental use. The motivation, this is no types of products, types of the march or the commercial motivation, but the technical injury and clinical motivation, okay? The cooling system and design, the terminal types, the fiber on the eyepiece, the quality, the quantity of the light brightness fluence, the choice, the wavelength, and the source. Fourth, the essential to have the cooling system, because if you don't have the good cooling system, the power is not constant, okay? Have the peak of the power, it is not good for biostimulation. Another important difference, the handpiece. Another important difference is the handpiece. That laser we had chose must have a continuous fiber, the enter the handpiece and carry the light to the target cell and must not have interrupted tips. Because in this case, for example, it's not good for types of the laser, but not for the march or for the model, but for construction, for design. Okay. The system have two interrupts. One to connecting the handpiece and tips. In this case, I lose the power, and one to the fiber connected the handpiece. If you have lost the power, you use the high power because one part is lost in the connection, in the interrupted. Okay. If you use the high power, have minus fluence. What is the fluence? The number to the cells that touch, the number to the particles that touch the cells, okay? If you have high fluence, I use the low power. If I have low the power and the number of the particles, I use the high power. I want to reduce the power. If you reduce the power, have a predictability to the holding on the screen, okay? Another important choice is the types of the wavelength. And the China use the laser with the wavelength 908 nanometer. It's not good because these types of wavelength affinity with the water causing the tissue necrosis. Okay, the broken cells. I don't want this. When I use the laser for the cutting, the surgical, I want apoptosis cellular, no necrosis cellular. Okay, this is so much different for cicatrization time. Okay. Another types, if you remember Professor Scarpelli, okay, in publication on the photodynamic therapy, you see that we have a deadline, the 830 nanometers. Over this is not good for the cells because have absorption to the wavelight to the water. This is laser. This is not good, not for the mark or the model or the country to the produce. Okay, but because this is use the 808 nanometer and no good for the cells. The best laser wavelength for medical use, such as biostimulation. For biostimulation, decontamination, and the surgery are the 810 nanometers primary light and the 635 nanometers secondary light. Both must emitted by the single diode, so the best tool and the laser with two complex diode. Okay, I don't want the laser in same ideas, one primary light and secondary light, the LED. The LED only illumination, don't have efficacy, the clinical efficacy. Okay, it's good only this two diode together inside the laser and don't one diode and one LED for red. Okay. Okay, the protocols. As I limited before for this type introductory courses educational, we convert some of the protocols, one most representative of each of the family, only all the AD. Okay. Derived from the protocol derived from the science and the international scientific publication review, for example, Cochrane, Medline, PubMed, and Natures. For management of the fundamental of light laser, it's for times, power, focalizing, fiber action. The fiber action due to big family to the protocols, okay, the treatment. One family when I need the hot, one family when I need only irradiation. If you want the hot for the cutting, for the surgical, for the nitrated, for ablation, for evaporated insensibilization, use the active fiber. What is active fiber? When I touch the head of the fiber, okay, and this fishing inside to the head, the color to the paper, blue paper, this is the paper to the neatologic checking. In this case, every particle of the light go to the color, okay, emitting don't only irradiation, but the hot in this position. And this is good for dehydration, for surgery, ablation, and desensitization. When I want to use this fiber for decontamination, for example, periodontology, endodontics, biostimulation, I cut inside the fiber. I use the diamond pen, for example, this, and cutting. This is not cutting the skin, but cutting the glass and open the fiber and the light go on free. Okay, in this case, possible use the wavelight for the biostimulation and contamination because two big family, periodontics, endodontics, biostimulation, disactivate the fiber. Surgical, activate the fiber. Okay, periodontics, the first family of the treatment. The contamination pocket refers to the publication, okay? Periodontics pocket hygiene. Measure the pocket, okay, this is possible, measure the pocket and shorter avoid the mechanical demand only because I have the possibility range to the longe to the fiber, okay? If you use only the tips, when you cut in the tips and only one measure, In this case, I possible change the mesuration to the extend the fiber, okay? And second moment, I put inside in the pocket the vitamin C with the water and vitamin C. And second irrigation use betadine iodine. And the second time use the laser for 30 seconds inside the pocket and use mesial, distal, mesial. Don't touch the bottom to the pocket because I don't want to broken the ligament, okay? And after I do 30 minutes, 1 minute to the biostimulation. In this case, this is the first one for the dentist. I the tutor is I help the in the directory for the use the laser. In this case, use the vitamin C, and then I will use the povidone iodine. Fiber deactivated, non-activated, okay? 1 watt the power for these types of wavelength, no same another types of wavelength. Put inside, and the contamination. Don't touch the bottom, and mesial, distal, okay? After I cleaning the fiber, and the biostimulation for 1 minute. Okay. Okay, when the three classic symptoms of periodontal infection disappear, for example, pain when chewing, bleeding, and inflammatory, I think the infection is stopped. In this case, the protocol during about 5 sessions, 1 for week, in the first 3, I insert the fiber inside. The protocol just the script. In another 2, the last 2 only use the biostimulation because I think the long epithelial attachment is reforming. I don't want to break with the mechanical movement the fiber, okay? Only biostimulation, the last 2. The first put inside the fiber in the pocket. Okay, when I usually course with the pocket that are deeper over the 7 millimeters, or as I see the rain, the board is compromised, possible choice, they use the technical surgical, don't open, sorry, the closing, the pocket closing, but the open types of the treatment. For example, this is Dr. Fabrizio Nani to the Florence in Italy, use these types of the technical. You remember that the bone is composed of the 2 parts, 1 part mineral and 1 part the organics. These types of the laser don't have action to the mineral. For the action to the mineral, you use, for example, the erbium laser with light 2840 nanometers. In this case, I think only the organic component. The organic component is the osteoblast, osteoclast, and osteocyte, and the mesenchymal cells. Okay. If you have these types of the laser, possible use the mechanism allow the precipitate in the bone. The scary problem is the true, they use the 810 nanometers involved the reduce the antigens, because you remember the osteoclasts are macrophages. If you reduce the antigen, reduce the macrophage. In this case, the osteoblast become mature osteocyte in the temp reduce. And the secondary light and the stimulation to the 635 nanometer to the mesenchymal cell for production for for the osteoblasts. Okay. This is an example to the treatment. This is the surgical treatment. Okay, the Festona tools and the total flap. In this case, there's a cleaning which use the dealer for the clean the bone. And in this case, use the laser, the contamination and biostimulation, reduce the number to antigen, reduce the number to osteoclast, the osteoblast become osteocyte in predictable time. And the secondary time after the stick by stimulation for osteoblast for healthy completed. You see the patient about after 1 week on 10 day for remove the stick and a second session on the biostimulation. Possible use the biostimulation for the 4th session after the treatment. This is a reduce the time of the healing. Per-implanted, this is the same, okay? The artificial root is the same for the natural tooth, okay? We divided for 2 types of the treatment to reversible per-implanted, the mucosit, and don't reversible, in this case, the osteoid. For the mucosit, is the same, the treatment, the pocket, okay? If you see, it's the same. I have the problem to the collar to the implant. I check the protocol treatment. I use the vitamin C and the betadine. Okay, you possible scanner to planning mechanical before this treatment. Okay, if you want it possible. Don't touch the gun, but possible touch the titanium because these types of Everlight don't have interaction to the titanium. Okay, don't deformation titanium, don't hot the titanium. Okay, 1 minute for the contamination of the color. Okay, and after you're cleaning the fiber, disactivate the fiber, if the activate automatically because touch the gun or the blooding, in second time you cutting the head of the fiber and biostimulation. You see the patient for 4 sessions for the biostimulation and the contamination of the zone. When the compromise the born, okay, the similar the treatment, the open sky operation. In this case, I use the toluidine blue, okay, for coloring the zone, and after use the laser. Before use the mechanical decontamination, and the clinic can use the toluidine blue as a chromophore to amplify the effect of the low power laser, about 1 laser, 1 watt, sorry, with the decontaminated fiber after the biostimulation. Other treatment in the same family, but don't possible the script heavy treatment for family, only the representative treatment, okay? But you think it possible use the laser for gun recession for the conduction on the gingival collar and gun dyschromatum. Another family to the protocols are the surgery. Okay, the scientific paper. Okay, frenolectomy is surgical technique for remove with the diodă laser. With the possible use to the laser to vertical signature to the surgical, and second time I open the diamond window, okay, broken the fiber. During this treatment about 5 minutes. In this case, the tutorial. This is the first one, and the dentist use lower because I have the first one they operate. Okay, you remember that if you want, if necessary, the surgical action continues below the interproximal area for exigence to orthodontics, it's possible evaporate this zoom. Okay, secondary intention, the scarring, no bleeding, no stickers, non-inflammatory, don't bite for the patient. Okay, the similar treatment to lingual frenolectomy from the pathological condition to rehabilitation, only different the anatomics construction, because this case have dangerous zone, the floor, the toe, namely the sublingual early. But this is no problem because I broken the sublingual artery. I stop in this, focalize the movement, okay, I stop it. And in this case, this is the rotation, the bloating, and hemostasis condition. In this case, I don't use the infiltrative anesthesia, but only use the lidocaine gel and blown to the unit. okay? The cutting, the vertical incision, and after open the window, the diamond window, cleaning the fiber. I don't want the fishing inside the little trash. Okay, they open the window, and after use the gel for hydration, and stop and finish the work. Don't steal, don't blooding, don't pine after the treatment. About the condition for second intention for 1 week, you see the pattern and biostimulation zoom, but you have finished the operative. Oh, preparation on the fourth zone. Okay, in this case, I don't use the retraction cord, but I possibly the laser perpendicular to the cleft and the parallel to the stump. Okay, this is no good for the implant, but you have the laser action the fiber. Okay, 1 watt of the power and the road to the stump, the parallel to the stump. Well, 5 minutes, 5 seconds, 10 seconds, this is the result. You want biostimulation, take the implant, you see the pattern about 1 week is the same. Don't have a problem to regradation to the gum. Gingival hypertrophy caused to medical use, for example, nifedipine. In this case, I have a brush with the laser tips activated, removing the surface cells. I must always clean the fiber at the calling the tips. With the written to show the following the video. In this case, the tutor, okay, the starting slowly because the first one for the dentist, but I see many quickly. You think in this case only the brush, non-incisive, no cutting, only brush in the zone, okay, and after biostimulation. This is types of intervention during about 50 minutes because I have 2 hours. 8 minutes for 1 art, 8 minutes for another art, but because 50 minutes you finish the treatment. You see the pattern about 1 week, a possible refresh in any zone because this problem is a recidive if the treatment is out life for the use the types of the medicine. Planning included. Again, the laser is very conservative, does not damage to the tooth. And we were able to place to the bracket in the same session because there was no bleeding. In the secondary intention, no sticker are the necessary the series of the photosensitive stimulation session is recommended. Okay. In this case, I use the lidocaine gel. Okay, activate the fiber, use about 1.5 watts, and open the opercle. You see the tooth, okay, open. Don't problem the stick or the bleeding. Okay, use the collage. Take the bracket and position and traction only in 1 session. Is the finish the treatment. This is the during about 5 minutes. Okay, when you start to when finish about during 5 minutes. If you want, you see the pattern about after 1 week and 1 session on the biostimulation. Okay, other treatment in the same family, the pullets, the intraoral peduncular, the operculum, the histological speechment, and the lingua papilloma. You remember the lingua papilloma, it's different to the peduncular fibroma because it's same to the anatomic conformation, but no biological condition because the surgery is similar to fibroma, but in this case, the singularly low power is used to preserve the sensory capacity to the organ. In this case, for preserve the sensory, you use the low power, and during about 30 seconds over the treatment of the peduncular. Peduncular during about 1 minute and a half, lingual papilloma use the low power during 2 minutes or 3 minutes, but preserving when holding the tissue. Or precancerous. I discussed this topic at the recent SNOI conference with the lasted about 2 hours. Here is a summary in few slides because don't have times. Okay. We have a free operation solution for the treatment of precancerous. The first treatment about I use the 90% case. The second treatment, the 9% case. The third treatment, 1% case. Okay. Leukoplakia, for example, I use the first treatment in case we pick flap with the tweezers, and with the laser fiber, we position ourselves 45 degrees and detect the fibrosis and tissue and leukoplakia, and cutting this flap, the leukoplakia. Remove the tissue. Okay, this is condition after 8 day finished the intervention. And the second solution, the lichens don't have the fibrotic tissue. In this case, only brushing the zone. Don't cut, don't touch the flap, okay? Don't remove the flap, but evaporate the tissue because this case don't have the fibrotic. For example, you see this, in this case, the tutor, the blow to use the air because refresh the zoom. This is the condition. Don't blotting, don't inflammatory, don't stick because don't need. This is during about 3 minutes. Okay. If you see the condition is the good for the color, the gone. You use the air for reduce the cooling. You use about 1 watt and half. Don't use the infiltrative anesthetic, but only lidocaine gel. Okay, solution number 3, in particular types. This is so much particular types. In your career, about you see 1 or 2 cases, these types, okay? When you use the types of the particular protocols, when you have the patient that have anticoagulants use, possibly hemolysis or hemophily, or poor immune capacity. In this case, use the laser with the 5-ALA, acid aminolevulinic, okay, or methylaminolevulinic. This is 2 same acids. Together, when you stand by 1 hour, the oxygen position release development in protoporphyrin name. Protoporphyrin name ligand only for precancerous cells, not the good cells. In this case, you use the laser and release oxygen singlet and oxidate the cells damage. Okay. This is possible only if you have 2 diodes, no 1 diode and 1 line, because have need the power, the red light, about 100 milliwatts. If you use the LED don't have the power, don't have the milliwatt, okay? For the starting the function of the protoporphyrin name, it only if you have 2 wavelengths, the first and the second. Okay, another protocols, it's the ROC technique. ROC is acronyms in Italian, ricostruzione ossea combinata, in English, combined bone reconstruction. This is in the pics, my friend, the Professor Lucas Lancieri, of University of Genoa is created onto the rock technique, which involves the combined use the mineral nanotechnologies, piezoelectric surges, and diode laser to repair the bone defect. Following the Professor Guidos, after the surgically preparing the seat with the mix betadine types calcium triphosphate dimension to 500 and 1000 micromillimeters, and TCL colifibrin. The mixture sold have the consistency of the wheat salad. This is a song that they use the professor. Okay. We biostimulated the contaminated area with 810 nanometer, 625 diode laser, and the aptly regenerative mixtures. In this case, I have two results. One, there's technique rock, and one for the biostimulation. You remember that these types of the wave light stimulation osteoblast development in osteocyte in just a little time. Oh, the third family, the endodontics. The endodontics, this is the paper. Okay. Dentin hypersensitivity treatment, the protocol showing that tubulars first simulation them to dilate with hydrogen peroxide, then directly to fluoride gel, and subsequently they using the laser to evaporate the water for the fluoride, the gel so come of the closing the tubulets. Open the tubulets because you use the oxygenate, the peroxide water, okay? And then you use the fluoride gel, and after activate the fiber, but use the low power, about 0.3 watt, okay? And take off the water to the gel. The fluoride go in the tubulate, and the biostimulation they close in the tubulate, okay? In this case, standby 10 minutes for reduce the delta T to the temperature starting and temperature to finish the standby, okay? And after checking the sensation of the patient pine. Or rectal pulpal capping, in this case, cannot be done because the tooth in the roten are the pulpectomy. In this case, only pulpectomy, the surgical condition. Okay. In this case, possible use the pulpectomy, no pulpectomy. In this case, the pulp is a soft but pulp. The mange is recent. Okay, I can try performing the pulpectomy and preserve the cavity. I activate the fiber laser and the apply about 0.8 watt, like burn the lesion, and so see the pulp clear and the form of the collage right. You see the change of the color. The color is white to the collage, okay, and hard to the touch. If I have two types of result, okay, is a pulpectomy and direct capping. If you don't see these two changes, the color and the touch, you don't go to and the pulpectomy. In this case, pulpectomy or canal treatment. Okay, the operative, the cross check in the side to the canal, and this is movement, a liquidal movement. Enter the canal with the laser off up to the apex without tucking it. Deactivate the fiber and the spiral movement, the liquidal movement towards to a coronal area. In the return towards apex, still sparing the working about 10 or 20 seconds per canal, and the 1 watt and 2 micromillimeter fiber. In this case, don't use the fiber to 400 millimeter, but 200 millimeter. This is a specific fiber. It's inside the box to the laser for the use endodontics. This example is a recreative, the secondary session. But if you want, close only one session, okay? hypochlorite, you use hypochlorite. The first section, use hypochlorite and put inside the laser. Expiration, and the second, third treatment, 20-second dry canal. First, we inside the hypochlorite. Second, third dry canal. Okay. The movement liquidal. Don't touch the bottom to the root canal. And movement for the coronal zone. And often closing. Okay, it's possible closing. You see the pattern about 20 day and check for the X-ray. Other treatment in the same family to endodontics, the abscess, the ontogenic fistula, the exposed dent in the pediatrics, and the apexectomy. After they use the drill or the piezo, you use the laser for hurting the gluteal park. Possible use the laser and the biostimulation. After every treatment of the surgical, you use the laser for biostimulation. Biostimulation is another family of the treatment. You remember in this case, you use the biostimulation after every treatment for the 4 session, 1 week, the distance to the 1 session, the second session, third session, and fourth session. The first treatment, the biostimulation, it's a bleaching. Operating principle, the 810 nanometer laser light induce the hydrogen peroxide, separate the oxygen, the atoms from the bond with the hydrogen. So to create the free radicals ready to break down the organic component and the bleaching the tooth. Okay. This example. Okay, so much important. You use the color gel, red, brown, blue. Okay, don't use the white or the transparent. Okay, 30 seconds for elements, and after standby 10 minutes for oxygenation. Okay, don't use the forked. The forked divided the light, but no equity divided. It's not good for the use the laser. The forked only for LED. If you want to use the laser, you use the handpiece with the length. For example, this. Okay, I think you see this. I have the length. This is good for these types of the treatment. Other treatment is the same family. The treatment the after. Osteonecrosis is a difficult treatment, but it's possible. I described in my book these types of the treatment. The herpes labialis and the case of the chemindux mucosid. Okay, I finish for dentistry treatment. I only the demonstration the dermatology treatment possible use for I don't have times, but I see for you, okay, for you remember the worms, the cheilitis, antelasma, psoriasis, and so on treatment. The lentigo so much important for the women this type of treatment. Okay, another treatment it's aesthetic medicine. Found the main benefit this technology are the fiber revitalization collagen, the lasting reduction, reversing the negative effect of the UV rays, and the cellular biostimulation. We have 8 types of the treatment inside in the book and in the laser program for these types of the family. Another family is the Venus lake, a possible treatment to the hemangioma, flat and cuneiform, rosacea, telangiectasis, and the spider, another types of the problem to the Venus lake. If you want, possible use this laser for the physiotherapy. The treatment of physiotherapy is important to the inflammatory, the scar predictability, and reduce the pain. We have 20 types of the treatment in a different zone of the body, but important TMG syndrome for triggering points, and the treatment for ligament, for the muscular, for the pain, the inflammation, the postural, or different types of treatment. In the scholarization courses, every treatment have the slide, have the explanation, and the videos, okay? Because during about 3 or 4 hours. So much important, after you've finished the course, you have demonstrated the level 2 knowledge. Okay, by attending the course like this, where you receive the certificate in the scholarization courses, but not only that, a copy of the course syllabus. This is important for authority. Okay, by the attack, the specificity and the safety was discussed, and the copy the 30 questions I will answer to the pass the courses exam. You requiring by local law, for example, in Italy, this is necessary for the use. Okay, at this point, the question is spontaneity. How much does the cost made can be my return to use the laser technology in my office studios? Okay, it depends on the technology, the schooling, and the time received. If you use the right technology and receive another training, you having the turnover can improve about 20% each year. If your turnover 100, with the laser becomes 120. This is a percentage of the median. So to be efficient and effective and profitable with laser technology, you need to schooling, training continues, because refresh, remember the treatment is stimulated in the user. Don't use it only for 1 family or 2 family, but 8 family they use the laser, the complete station to the technology, okay? If you use the wrong laser, I don't take the courses, the instrument become ornament. This is the ornament, no good for you, because don't have the good wavelength and don't have the training for the use. This is the good ornament, the costs, so much cost. The difference between the investment and the cost. If you want cost, take this. If you want investment, take the technology and the training courses. I'm sorry, I had to rush the final time. I'm sure to solve your question. You can ask them after the course via WhatsApp or mail. And so, to a possible, we organized more in-depth courses. Okay, I'm now starting and webcam external and see the treatment to the tissue. Okay, this is my contact if you want the contact after the courses. Okay. Okay. I change the cam now. Okay. I show you that with the fiber, I take the blue paper. Okay. Okay, start. Okay, one touch. Okay, you see activate the fiber. The fiber is ready to start. You see the, oh, sorry, okay. You see the color in the side, okay? Every wavelength is go to this color, and the ready is start to the surgical. Okay, I have 2 types different to the tissue. One tissue exchemised, don't have the bloating. In this case, I have the bloating. This case use the laser quickly because the bloating attract the laser. Okay. Now I cutting the laser. I cutting the tissue. If you see, I have cutting the tissue. Okay, I am cutting this. This is difficult because I don't have the bloating, but in this case I use the laser slowly. If the movement is slowly, it's possible you cutting this. Only with these types of the laser is possible use for the cutting when don't have the bloating. Another types of the laser, for example, 800 and 8 nanometer don't possible this result. Okay, if you see, I have cutting this, the open the flap. Okay, and second moment, if you want the action to treatment of the biostimulation, take this, don't cutting this, but cutting only the fiber, only 1 millimeter of the fiber. Okay, and now change the protocols, biostimulation. Okay, in the zone of the surgical zone, only the little rod, don't touch this for treatment. This is the movement for the treatment of the biostimulation. After every treatment, the surgical, you use the treatment of the biostimulation. In this case and this case, okay? If you want to, you see the patent about 1 week, you repeat this. I return in my position to the PC. Okay, I finished the courses. This courses is short because only educational during about 1 hour. If you want, when you have the laser possible, do the courses individual for every dentist during about 3 or 4 hours, and second time the possible online the tutor or in present the tutor for you if you want. Thomas, if you want see
Yeah, so thank you so much for the presentation, and I hope it's little bit clear for everybody the laser technology. But what you said, we can make a deeply presentation.
Yes.
Everybody is interested in to buy a creation laser. We are ready for that.
Sorry, Thomas, I recording the course. I send you if you want. Send your friends the replay the courses for you receive and put inside the mint.
Okay. So thank you so much. Thank you so much. Everything.
Okay, Thomas, I include in the webline.
Okay.
Good
So
night. Good
thank you
night.
so much. Good night. Good night.
La revedere!